For this video, I'm going to be doing the varus and valgus test of the elbow to test the ulnar collateral ligament and the radial collateral ligament. So to start, I'm going to do the valgus. So I'm going to have Chipper here in full elbow extension. Then I'm going to provide a medially directed force, trying to open up the medial joint. And then I'll position him to about 30 degrees of flexion and perform the same motion. Positive test would be laxity or patient reporting pain. For the varus, we're going to be doing the same thing on the lateral aspect. So I'm going to start him at 0 degrees of elbow flexion and produce a laterally directed force. And then the same thing at 30 degrees of elbow flexion. And a positive test would be patient reporting pain and or laxity. For this test, I'm going to be doing the moving valgus test for ulnar collateral ligament sprain. So you're going to bring your patient up to 90 degrees of shoulder flexion, and then you're going to move them through extension while applying a valgus force, feeling for any joint laxity or patient reports of pain. The laxity would be popping, any joint laxity giving out. You might get some ulnar nerve involvement as well. For this video, I'll be going through the epicondylitis tests. So to start, I'm going to start with the handshake. So you're just going to have the patient shake your hand and have them squeeze, 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 and you're going to palpate the medial epicondyle for any reports of pain and the lateral epicondyle for any reports of pain. And then from here, we can do the passive medial epicondylitis test. So you're going to start palpating the medial epicondyle with the patient in supination and wrist extension. Then you're passively going to extend the elbow and extend the wrist while forcing more supination while keeping palpation over the medial epicondyle for any increase of pain. And for lateral epicondylitis, they're going to be in forearm pronation and wrist flexion. You're going to palpate the lateral epicondyle and move them into elbow extension while forcing excess pronation and wrist flexion for any increase of symptoms. And then for the next test, which is Cozen's, I'm going to have Chipper sit on the stool for me. I'm going to have his hand flat on the table and lift his middle finger off the table and hold back. I'm going to palpate the lateral epicondyle and press down on the proximal phalanx. A positive test would be pain referring all the way up the forearm to the lateral epicondyle. For this video, I'll be going through special tests for nerve pathologies at the elbow. So to start, we're going to start with the elbow flexion test. So I'm going to position the patient in elbow flexion and wrist extension. And we're going to hold this for 30 seconds and a positive sign would be numbness and tingling following down the medial aspect of the forearm and into the 4th and 5th digits. The next test is Tinel sign. So I'm just going to have the patient relaxed. Then I'm going to palpate the cubital tunnel and then tap for 30 seconds. A positive test would be a spark sensation traveling down the forearm into the 4th and 5th digit in those regions of the palm.
So the next segment that we're going to be doing is the forearm, wrist, and hand test. The first test that I'm going to do is the flexor tendon avulsion test, and for this you want to have your patient have both hands up and try and make fists, and you're trying to see if the flexor tendon is avulsed. If it is, then they're not going to be able to bend this finger all the way. So people, can you have your arms up and close your fists? Good. She's normal. If it wasn't, like I said, the flexor tendon, they wouldn't be able to flex their digit all the way down. Another test you can do is an extensor tendon avulsion test, and for this, you're just going to have your patient actively extend their fingers, and you're looking to see if the DIP doesn't extend. Good. All of hers extend. If it didn't, that would be a sign of mallet finger. So next I'm going to be doing varus and valgus at the wrist and the fingers. For the wrist, you can have your patient sitting down, forearm on a table with the hand outstretched. For valgus, you're going to grip the hand and you're going to apply a force inward. And that's testing the UCL. For varus, you can apply a force outward, and that's testing the RCL. At the finger, you're going to have them in zero or in full extension, and for the RCL, you can just press out and UCL in, and then at 30, so slightly bend, out for the RCL, and for the UCL. You're feeling for any joint mobility, laxity, and pain. So the next group of tests that I'm going to be doing, the first one is the TFCC load. You can have your patient sitting down, elbow on the table, hand outstretched. I like to flex the fingers when loading the wrist joint, and then ulnar deviating. A positive sign of having a TFCC problem would be pain in the TFCC area. Another test you can do here as well is the anterior posterior glides. So that you're going to load the joint and then you're going to passively flex and extend the wrist. As well as you can do metacarpal phalangeal joint laxity, which is where I like to have their hand over and stabilize the joint and then just move the hand up and down and do this at each joint. And notice as you move to the fifth metacarpal, the joint gets more lax, and that's normal in most people. For this, you're just testing to see if they're hyper or hypomobile. The next group of tests we're going to be doing is Phelan's and reverse Phelan's for carpal tunnel syndrome. So for Phelan's, you're going to have them kind of make a prayer, and you're going to make them, or their elbows are going to come up as the wrists sink down, and you're going to make them hold this position for a minute. Positive sign of having carpal tunnel would be pain in the carpal tunnel area, as well as numbness and tingling through the fingers and in that carpal tunnel. Another test you can do with this is reverse Phelan's, which is where you're going to have the wrists in flexion, and then you're going to drop the elbows to try and force more flexion. This is going to, if somebody has carpal tunnel, this is going to cause pain and numbness down the fingers.
Today I'm going to be doing the Snell's test. So for this test, it's for carpal tunnel and also the median nerve. So I'm just going to tap right here, and I'm going to do it for 30 seconds, and they're going to feel numbness and tingling down their hands if they have a positive test. Do you have any numbness and tingling down your hands? So he has a negative test, and that is it. The next test is Allen's for patency. So for this, I'm going to ask you to make a fist 5 times and hold it the last time. And then you cut off the ulnar and the radius, and then can you open your hands? And then I'm going to release the ulnar side, and it releases, and all the blood flow goes back to the hand, and then we're going to do it again 5 times. And then hold it the last. And then I'm going to release, open your hand, and then I'm going to release the ulnar and see how fast, and then you compare which one comes back faster, and if the one that comes back the slowest is probably damaged. The next test is 2-point discrepancy. So I'm going to put a paper clip to their nail, and do you feel that equally on both sides? Mm-hmm. Do you feel it equally? Mm-hmm. Equally. And if they don't feel it equally, then it's a nerve damage. And you can also do this test with their eyes closed, so then they cannot tell when they're looking at, they can't tell when the paper clip is hitting their hand. The test that I'm doing right now is a test for Decker veins, and so I'm going to ask the patient to put their thumb into their fist and make a fist, and then I'm going to passively move them into ulnar deviation. Is there any pain with that? Mm-hmm. If they have pain, then it's a positive test. This test is trigger finger, so I'm going to ask you to extend your hands and flex them as much as you can. And a positive test is if their finger gets caught and stuck in this position or anywhere flexed. and that can not get all the way back to fully extension. And then the other test is Benel Littler. So this test is also an opening and closing. And then you're looking to see if the PIP gets stuck at some point, so it might take longer to flex, so your finger could end up like this, and then it'll slowly flex, and then can you turn your hand over, and you do it the same way. So open and extend, and he has a negative test.